On behalf of Limbombo Spatial Development Initiative 2, LSDI2 for short, welcome to an overview of the MOSASWA Impact Evaluation, which you will find included with this presentation. We would like to firstly thank Dr. Shufang Zhang and the Impact Modeling and Program Efficiency Strategic Information Department of the Global Fund for funding this really important evaluation, and the Global Fund South African Country Team for their continued support and guidance throughout the evaluation process. We would also like to thank Dr. Emily Poutine and her team of the Swiss Tropical and Public Health Institute for their insights and work on the evaluation as commissioned by the Global Fund. Right, let's get into the findings and recommendations of the report. The evaluation explores and highlights contextual, organizational, and other reasons for the malaria trends. So in answering the core questions, the report is structured into three components, which will each be addressed separately, namely epidemiological impact, an efficiency analysis, and an effectiveness evaluation. You will hear from my colleagues who will describe the key findings and recommendations raised through this evaluation. The epidemiological component considers the impact of IRS on malaria indicators at the local level. The analysis investigates all potential drivers for IRS and other factors which could explain the change in malaria incidence. So Swiss TPH used an open malaria dynamic transmission model to reconstruct the malaria trends per district, to estimate the impact of IRS and provide a counterfactual scenario for what would have happened in the absence of IRS. The efficiency analysis included three key aspects. Firstly, detailed analysis of IRS expenditure and the calculation of related efficiency indicators within each district. LSDI2's unit costs were compared to those of other IRS programs being implemented in Mozambique, for example, the President's Malaria Initiative and their partners, as well as outside of Mozambique. And then secondly, a review of the financial performance management and monitoring procedures and tools. The last component of the evaluation is the effectiveness component, which provided a qualitative analysis through 20 key informant interviews, which assessed the perceptions, priorities, achievements, and perceived barriers during the grant. A survey was conducted with 338 spray operators who participated in the IRS campaign during the grant, and it also allowed for a focus group discussion to really gain further, deeper insights. You will now hear from Francois Martins, the co-CEO of LSDI2, with regards to the epidemiological findings and recommendations. Thank you.
The epidemiology section of this report will cover IRS in 12 districts in 3 provinces in southern Mozambique. 8 districts were sprayed in Maputo province, 2 districts in Gaza and 2 districts in Inhambane. As can be seen on the graph, a decline in incidence was achieved in all 12 districts between 2017 and 2019. Inhambane, Mashish, Limpopo and Belén achieved a 75% decrease in monthly malaria incidence after the 2019 to 2020 IRS spray rounds. Buan decreased by 75% and all other districts decreased by 40%. Belén, after one spray round between 2019 and 2020, decreased monthly incidence from 40 people per 1,000 to 10 people per 1,000. The malaria incidence was systematically lower in districts of Inhambane, Limpopo, Matola, Matatouine, Namahash and Mashish. When looking at the relationship between IRS and malaria indicators, Inhambane, Mashish, Limpopo and Belén achieved up to a 75% decrease in monthly malaria incidence after the 2019 and 2020 IRS spray round. Buan decreased malaria incidence by 75% and the other districts decreased by up to 40%. Belén, after one season of spraying between 2019 and 2020, decreased monthly malaria incidence from 40 people per 1,000 population to only 10 people per 1,000 population. The malaria incidence was systematically lower in districts of Inhambane, Limpopo, Matola, Matatouine, Namahash and Mashish in the years when IRS was implemented. When looking at the malaria cases and malaria incidence graphs, the ratio between the incidence at the starting months of IRS campaign and the 8 subsequent months showed that there has been a drop of incidence of up to 75% in the districts in Gaza and Inhambane that persisted for over 7 months. Malaria incidents appear to be lower when IRS was implemented when compared to other districts in the same region of Gaza and Inhambane for districts that were not sprayed. When looking at the malaria cases averted bar graph, Maputo presented the highest number of cases that could be averted in the whole population, with a maximum of around 180,000 cases per year. The province of Gaza has half the maximum of number of cases averted compared to Maputo, even though the population of the sprayed districts in Gaza accounts for only a sixth of the total population of Maputo. The maximum number of cases averted are comparable, highlighting the difference in transmission for each setting, leading to a higher burden in the under 5s and therefore higher potential to avert cases in the higher transmission settings. In higher transmission settings, much of the burden of the disease is carried by children as older people who were exposed to the disease have survived and developed natural immunity. On the other hand, in low transmission settings where people either do not have immunity or lose the acquired immunity due to lack of exposure, the burden of the disease is more equally distributed across all age groups. When looking at the number of malaria cases averted per population graph, all districts show a positive impact after the IRS spray rounds. The districts with the highest potential to avert cases are Inhambane, Belen and Limpopo, both for the whole population and for the under 5s. In conclusion, the operational coverage for all districts exceeded 85%, with high population coverages for all districts achieving maximum impact of IRS. A decrease in yearly incidence was found in all districts where LSDI2 conducted IRS. Matola has the highest number of cases averted, driven mainly by its large population. Districts in Gaza and Inhambane has the next highest number of cases averted, and this is mainly driven by the fact that there's very high malaria transmission in those provinces. Districts in Gaza and Inhambane have the highest potential to avert cases per population protected, both for under 5s and other age groups. The maximum simulated number of cases averted for the whole population for the spraying campaign of 2019 was approximately 310,000 cases.
In the effectiveness section of the report, you will read the views and perception from the key informant, which included program implementers, government stakeholders from central and provincial level, technical partners, and the private sector. The qualitative component provides insights into many of the aspects contained in the EPI section of the report. The report articulates a few different themes which emerge from the interviews, including improving data sharing, data systems, also improving collaboration between the entities, and the consensus that a holistic vision is needed for malaria elimination in southern Mozambique, and not only entomological suppression through IRS. The importance of governance and the establishment and the effectiveness of the RCM in the grant is illustrated in this code. Stakeholders emphasized the important influence of the RCM in the region and its role in catalyzing additional funds. There is also acknowledgement that collaboration and coordination with the NMCPs improved over the duration of the grant. Innovation, planning using data, technology, communication, challenging the status quo, escalation of issues to address timelessly, and financial discipline are all aspects which enable effectiveness and efficiencies to be realized through the grant through a private sector mindset. Whilst the private sector brought a different level of thinking and energy to malaria elimination, the report also highlights the expected tension which can result from a difference in approach and bureaucracy in getting the job done. The STPH team were able to conduct a self-administered survey with the spray operators and a focus group discussion. The spray operator workforce come across as a dedicated and knowledgeable and provide insights into some of the challenges experienced during the campaigns.
The next element covered by the evaluation team focused on efficiency. For the purposes of this evaluation, the Swiss TPH team focused on technical efficiency elements, which included an analysis of IRS expenditure and related indicators, a review of the financial performance and monitoring procedures and tools, as well as a limited return on investment calculation. For the first element of efficiency, which was the IRS expenditure, the methodology involved a top-down approach, where all IRS expenditure incurred in South Africa, as well as Mozambique, was allocated to the individual districts that received IRS based on an accurate costing split. So, for example, the number of actual spray operators that sprayed in each district and related PPE. The cost only included direct service delivery costs. So, for example, donated insecticide that we received was excluded from the evaluation, but that is in line with all other comparison districts, as you'll see later on. So costs were split by district and by cost input, so for example HR or PPE in different cost categories, to provide a more meaningful analysis across districts by cost category as well. The primary basis for commenting on the efficiency of the program involved firstly unit costs were compared between districts and between years, and secondly the results were compared to different published literature. So for example, unit costs within other programs within Mozambique, including PMI partners, as well as certain programs outside of Mozambique. So the following graph that you're seeing shows the final IRS implementation cost split by category as well as by year. Some items to note related to this graph include across all spray seasons, the HR implementation cost, so the direct spray operator cost, comprises around 50% of the total cost. And as you can see, program management costs and administration costs proportionally declined slightly over time. Program management and administration costs proportionally declined slightly as economies of scale were realized as we added new districts as the spraying went on. So obviously looking at the first year, 5 districts, the second year was 8 districts, and in the third year we sprayed on 12 districts, and therefore things like fixed overheads don't necessarily have to increase to step up to that. So taking the above costing and splitting it by district, we get the following graph, which as you can see, generally we can see a decrease in the cost per spray season per district over time as we reach economies of scale in each district. To make this even more useful, the cost was then divided by the population of each district in order to get the cost per capita of each district. As you can see, the variability starts to become quite high based on factors that are inherent to these areas. Buwan, for example, is a small and heavily populated district with approximately 250,000 people, showing a cost per capita of around $1.52. By comparison, Namasha and Matatuine, where the cost per capita is roughly $5, have populations of approximately 53,000 and 49,000 respectively. Geographically large, more rural districts with relatively small populations and lower population densities naturally lead to higher costs per capita. So this unit cost of IRS was further calculated based on 2 sets of data: the cost to spray a house and the cost per person protected. For both indicators, districts such as Buwan, Manisa, Marakwena, Matola and Belen have consistently lower unit costs, whilst districts like Magud, Namasha and Matatuine have relatively high unit costs. As previously mentioned, the 2 major variables that contribute to this variability are population and setting, district size and therefore density. So if the 2019 cost per person protected is mapped against the number of people per district, you can start to see the high correlation between population and cost per person protected. In general, the studies included in the table followed the same top-down costing approach and included the same cost categories. In the table, you can see LSDI2's costs shown as a weighted and an unweighted average. So the unweighted average would be the total cost across all districts holistically divided by the total number of people protected. and the weighted average is looking at different weightings within those districts. So for example, in Buan you would see more people than you would see in Matatuin, and therefore the weighting is slightly higher. The table points to high levels of efficiency within the LSDI2 program, with the unweighted cost being roughly 21% less than the average cost of all other studies, and the weighted average cost being a total of 43% lower. The final element of the efficiency analysis focused on the financial management systems and policies and procedures in place at LSDI2. And the following were highlighted at a high level as unique elements that led to potential efficiencies within our systems. Usually SRs are managed through a sub-grant contract or service level agreement. Funds are then transferred and the SR is expected to provide the services and implement program activities and report back to the PR on a regular basis. In the case of LSDI2, the PR and the implementer in Mozambique are effectively managed as a single entity from an admin and operational perspective, which led to some efficiencies within reporting. From an ongoing financial management perspective, summary and detailed reports can be produced directly from our general ledger reporting system at any time, and expenditure is tracked daily using our Xero online accounting system. At LSDI2, financial management is an ongoing process rather than a once-off effort at the end of the month, and this is largely facilitated by the real-time accounting structures which have been put in place. This gives a high level of visibility at transactions as they unfold, and this also results in faster processing of payments and other routine finance tasks. The following recommendations were noted related to the efficiency section. The first one is the development of a structured decision-making support tool to inform the development of a tailored combination prevention campaign which draws on elements of unit cost, cost-effectiveness indicators, return on investment, and all of that taken into the broader context of programmatic contextual factors. The second recommendation is that we have to calculate district level unit costs and other efficiency indicators, and we should monitor these in order to manage efficiencies within different districts. And lastly, we need to routinely calculate district level unit costs as well as other efficiency indicators and monitor these in order to manage efficiencies within our different districts.
Thank you, team, for the insightful overview. I would like to take this opportunity to thank the Global Fund, Swiss TPH, the National Malaria Control Program in Mozambique, our colleagues at Goodbye Malaria, LSDI2, and everyone else that was involved with the evaluation. This evaluation is timely, given the need to understand the impact of IRS in driving the malaria elimination agenda in southern Mozambique, and more importantly, to remember the answer to malaria elimination is regional. In summary, I'd like to leave you with the key recommendations from the evaluation, some of which LSDI2 have already begun implementing. Research linked to behavior is equally important to define the IEC, BCC goals and strategy to understand aspects such as refusals, however small in the population. It is key that the MOSASWA stakeholders clearly articulate the goals linked to IRS in Maputo province to better assess the impact of spraying these low transmission districts and how this accelerates us to zero. There is the need to strengthen and expand surveillance not only in Maputo province, but also in Gaza and in Yamban, given the expansion of districts in these provinces. A skills transfer strategy from LSDI2 to the NMCP and other government entities, which include surveillance, M&E, and IEC-BCC is critical to capacity development and sustainability. We know that eliminating malaria was never going to be easy. It takes belief and endurance, overcoming every challenge with conviction and grit. But we're in it together, so we are stronger. Most importantly, believing we'll be able to change lives everywhere. Together, we can say goodbye malaria. Thank you.